Friends and family, welcome to another live broadcast brought to you by Premier's Turning Point, with your host, Bishop Dr. Uton Lang, and co-host, Overseer Franklin Williamson. We pray and hope that something that is being said today will bless your soul and spirit. Please take a quick moment to like and share this broadcast with your friends and family. Thank you again for joining us. Let's go into our live program.
Blessings, 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 one and all. The Bishop Dr. Lang back with you today as we continue our turning point, Premier's Turning Point, and we are about trying to get you all the information that you need as you progress and move along in life. I know we've been kind of talking a lot about the vaccines and all that stuff. We're going to take a little break from that this week. Of course, and most likely next week we can give you an update when we see what is going on. One of the things that we know that has been high on my list of things, and I know on many people's mind, is the various disparities that we see, in African Americans, whether it's in healthcare, the job market, whether it's in the range of illnesses. We see a major disparity. Even when we talk about the pandemic, we've seen quite a bit of disparity in that area where, African Americans, are affected just as much as everybody else, but we see where the death rate is much higher. So we wanted to tackle over the next few weeks, these disparities that we see, and then how we may be able to help and give some advice of helping to make it better. And this is one of the things that we see that is that's happening. So we're gonna do all our best to get you informed and get you, very up to date. So we're gonna have Overseer Williamson. Of course, he's my co-host, and he's gonna talk a little bit, and then I'll come back with some more specifics. Overseer, go ahead.
All right. Thank you for joining us again on Turning Point. And today we have shifted a little bit, as Dr. Link says, from our usual pandemic, COVID, vaccine, but still, we are still in the same grain. Today we're going to look at disparities to access of healthcare African Americans. And it's a wide topic, but we're going to try to do our best to really hone on the era of healthcare. And as you know, it ties into the distribution and equal access to the vaccine and also to testing. So stay tuned, please share, like, subscribe, let someone know we're on, and let them know that we have a very, very important topic that I believe that everyone would like to tune in. So join us now as we go into our session. Thank you. All right, you're muted, Bishop. All right.
Everybody to understand that this is a very important area, and we'll find, you find that there's a lot of issues that us as African Americans face on a daily basis. Other minority groups also face these issues. So I want us to really take a little bit of time to look at where we are, see where we are, and then also before we stop talking about this, we need to kind of come up with some plans of how we're going to make things better and how we're going to improve on what we have now. So we want to give out information, and then at the same time, we want to, get everybody up to speed. Now, just for some basic statistics, we know that minorities, so actually African Americans are probably the second largest racial minority group in the U.S., and we make up about 13.4% of the population. The white and non-Hispanic or Latino population makes up about 61%. And then when you look at the overall population, we see that we are not the smallest group, but however we're a fair size. But we see that African Americans, mostly who actually 55%, they're still live in the South, but we live all over. But one of the things what we'll find is that a lot of even though we make up 13.4%, a lot of things have changed over the years. One of the study that I was looking at, according to the Economic Policy Institute, uh, educational attainment has greatly increased, with more than 90% of African Americans aged 25 to 29 having graduated from high school, and college graduation rates have also improved among African Americans. When it comes to income, gains have been made as well, but African Americans are still paid less than white Americans for the same jobs and lag significantly behind when it comes to accumulating wealth. And as far as home ownership, just over 40% of African Americans own their own home, a rare, virtually unchanged, and it's actually virtually unchanged since 1968. Now, one of the statistics that I saw that I found was interesting is that African Americans are also living longer, and the majority of them have some form of health insurance coverage. However, African Americans still experience illness and infirmity at extremely high rates, and have lower life expectancy than other racial and ethnic groups. And they're also one of the most economically disadvantaged demographics in this country. So we see, even though there may be some gains that have been made, there is still a lot of disparity and a lot of issues that we're facing then on a daily basis. So I wanted to explore some of that. I don't know, Overseer, if you can chime in a little bit on any of those. Do you agree
Yes,
with
yeah,
that stuff, or what is? Yeah.
yeah. I like what you said about education and about employment.
Mm-hmm.
Let me give a definition on the word disparity. This way, we can set the premise on which we're going to go forward. Disparity is the condition of being unequal. A
Mm-hmm.
disparity, a noticeable difference. Disparity usually refers to a difference that is unfair. So, disparity between jobs, disparity between men and women, disparity between ethnic groups, disparity between race. So, here we're looking at a disparity, some level of unequal or unfairness for the African American to access of healthcare. Now, if we look at our system, most of folks who have access to healthcare is via their job. Their job will subsidize their health care. Now, if we are not employed and if our jobs don't provide us that level of health care, then right off the cuff, we are at a disadvantage. And as a result of that, African Americans are left to fend for themselves how to provide access to healthcare. You mentioned education. I'm glad to see the numbers are upticking, but still the numbers are way far below where it needs to be in comparison to Caucasians. Also, as far as home ownership, this is also another way in which we can equalize. Again, there has been a great increase, but again, it's still far less than our Caucasians. Now, this topic is highly controversial, and it borders on, you know, racial, racism, redlining, all right? But we want to look at why and what are the factors that causes African Americans not to have access. Now, there's a research that I looked at, and Dr. Ling, it speaks to about racism and how it affects African Americans. Uh, it creates a high level of stress. As a result, babies are born with low birth rate. Mothers have a high cases of hypertension. So right there and then, our children are at a disadvantage. Now, the healthcare system, if you look, let's say you take a control set, African Americans and white in the same neighborhood, of the same economic status, having the same healthcare system around, even when you walk into a doctor's office, the type of care given differs. So, how can we help with this disparity? What can we do to ensure that we have the same access? One of the things Dr. Lang mentioned, and I will stress that, is education. The more educated we are, is the better we will have access to healthcare. The more educated we are, then the jobs that we are able to be employed by is far much better. Studies show that, we may do the same job, but our pay scale is a lot less. Our total cash output, which means the benefits, the 401k, and all the benefits that come with the job, being an African American, you get the shorter end of the deal. So we want to make sure that our children are educated, that they're not only graduating high school, but they are going on to higher schools of learning, that they get their degree, their bachelor's, their master's, and move on to owning property. Now, when you have your education, chances are you will have a better paying job. And having a better paying job, that job will also be able to subsidize your health care, and you will be able to walk into any healthcare facility and present your healthcare benefit card and get the healthcare that you need. Besides the fact that, you may be fearful, and we know studies show that we don't like to go to the doctor, but that the contributing factor is not having access. So I really want to stress education. I really want to stress, because even those who are self-employed, the cost of healthcare is so high, and your business would have to turn around such a high profit to enable you to pay for your healthcare. And also, if you have children, then you have to also think about your dependents and what type of healthcare would they need. So, the equalizer, I strongly believe, is education.
That's a very good point, and we're definitely gonna come to that, and get to the place where we see where that is. And I think
Yeah,
that's a very, very important thing. And I think everybody, I want you to keep that in mind as we proceed forward, as we go forward. Keep in mind that we think education is probably the way that is gonna get us a little bit more parity then, and more equality and
yeah,
such. I want to spend a little bit of time and just specifically thought this report that I was looking at, really want to examine the state of health care coverage for African Americans, and look some light on some important social factors that uniquely impact their health outcomes. And in an effort to get the implications from the leading healthcare reform plans and all of that stuff, we want to look ahead and see African Americans are one of the most politically engaged demographics in this country. And then, so therefore, addressing our unique challenges and perspective include the pervasive impacts of racism. We have to include that in any healthcare reform that we're doing. And I think I will talk, maybe if not on today's program, what things we can do to get involved. Let's look a little bit at coverage gains and any obstacles from the ACA, which is the ACA plan that was passed, the Affordable Care Act. That has helped to ensure health coverage for millions of Americans. The uninsured rate among African Americans declined after the law was implemented, and of more than 20 million people who have gained coverage under that, 2.8 million of them are African Americans. Yet, this population is still more likely to be uninsured than white Americans. As of 2018, the uninsured rate among African Americans was about 9.7%, while it was just 5.4% among whites. And then we see from that same study that African Americans were more likely to be covered through employer sponsored or private health insurance. But 55% of them were covered through their employer sponsored plan and such alike. So while covering expansions under the ACA have kind of hastened the programs towards some more universal coverage, we see there's still a high cost of many of the coverage options, and therefore, a lot of people won't have won't be able to afford it, and such alike. Now, was one figure that I really was a little bit taken aback. The average family spends about 8,200 or 11% of their family income per year on health care premiums. And out-of-pocket costs, between healthcare premiums and out-of-pocket costs, such as office visits, copay, prescription, any surprise medical bills and stuff. And so therefore, medical bills continue to wreak havoc on the financial security of many families. And this is across the board. For African Americans, the average annual cost for healthcare premiums is almost 20% of the average household income, and a major cost to bear when taking into account income equality and other economic challenges. I don't know if, Overseer, did you ever think the figure was that high of what percentage people pay to really just to get their health coverage?
No, I didn't.
Yeah,
And
it really
it's
blew my mind. It really blew my mind a little bit because I know it was a lot, but when you
right,
really think about it, it's really, has gotten to be, even more than, than you would think. And it has actually happened that it changes. And yes, the AC has helped, but can you imagine if 20% of what you're bringing in is going to healthcare? That leaves 80%, right?
right,
Uh,
right.
how much percent goes to rent and mortgages?
Absolutely, housing, yes, and that's the
Housing.
reason why to reduce the 20%, they avoid occurring the costs
Yes.
and don't do
So that,
frequent visits, don't do the follow-ups and all the
mhm.
preventative care.
Yeah. So you're
Yes,
right, because if you got to give up your shelter versus your food and your health care, which one you think is going to suffer? Because people have to eat, they need a
yes,
roof over their head, and so you see why the healthcare becomes an issue because it is such a big cost, and therefore something has to give. And actually,
yes,
as I said, until I look at the numbers, I didn't realize that it was such a great. But when you think about it, also African Americans, their income is less, and they're
yes,
paying out a greater percentage. So you see, there's a big disparity of something that we have to try to see what we have to do. Now, they find also that the high cost coverage has kept the number of uninsured and underinsured high. Of the 27.5 million people that still lack health insurance coverage, 45% cite the cost as a reason that they're uninsured. Furthermore, the Commonwealth Fund estimates that an additional 87 million people, that is adults between 19 and 64, are underinsured. That is, they have coverage, but their plan leads to usually high out-of-pocket costs relative to income that can then lead to more strain on their personal income. And you see why this again is a thing. So you may have some insurance, but I don't know if you run into any of those people, but they have insurance, but what are their deductibles? What
yes,
are their co-pays? I mean, I've
yes.
seen deductibles as high as 13,000
Mm,
as their deductible. So therefore, until they hit 13,000, they really have to pay out of their pocket. So essentially, is out of pocket.
right,
So
and
so those are some
that's
of the stuff.
annual
Yeah,
deductible, and that's an
yeah,
annual, not a lifetime deductible. So
no,
every
no,
year, the thing is reset.
yep. Every year
Yes,
it's reset. So you could see then clearly that, when we're looking at the especially, and we're looking mostly at healthcare today, we see that this is a major problem. So now these underinsured adults, 18% of them are African Americans. So
Yes.
you see, it's a very high number of African Americans that are either uninsured or underinsured. I mean, I can give you even as much as being I'm a self-employed person. Technically, the cost of insurance, I can tell you. For example, I've kind of reshaped my office, but it was just to cover myself, family, and about three employees. That was $4,000 to $500 a month,
Mm.
and that was supposedly an employer plan that was supposedly giving you some breaks. So you see how it's really amazing, the cost. And that's one of the point that and this is one of the solutions. I would kind of hint at it now. We have to get in the face of our legislators. They have to realize what a problem healthcare is, because a lot
Yes.
of time, even with the Affordable Care Act, they still not have addressed the issue. A couple of things that has to be addressed, like tort reform, with that has to be part of the discussion, and then to how we're going to bring down the overall cost, whether we get a public option, whatever. But this discussion has to go on, because if not, we're going to see a loss of a lot of life, and especially African American lives. You know.
Yeah,
Hmm.
and I read something just a week ago when they look at the start now studying the deaths as a result of COVID and
Hmm.
why it's a large number in the African American, and they're saying it's again because of access to healthcare. The
Hmm.
fact that their health was in such a poor state because not having access. Now, this disease pretty much bring that disparity to the forefront, and now we have to look at access to healthcare. So it's the hypertension they're saying, it's the cancer they're saying, it's all these underlying issues, asthma, right? That is really, if they had access and frequent treatment, then and talk about food, right? The right
Yeah,
diet,
the right diet. Yeah. Hmm.
then you may not have such a high number of African Americans dying as a result of
Hmm.
contracting this COVID.
Yeah.
So
And, yeah.
access to
And that's
healthcare
what.
is yes,
And this is one of the reasons why we wanted to take up this topic, is because it's a major issue. It's a
yes,
major problem. And we see where access to healthcare and the healthcare disparity, affects every aspect of our lives. Because if your health is not, where it should be, all right, it's going to affect your every part of your life. You won't be able to go to work.
yes,
You won't be able to have your good, healthy family relationships. Every aspect, you won't be there to help out your children. So it really is, one of the fundamental, basic things that we need to get right, because so many other things depend on it. So many other parts of our life depends on it. So I think it's a really, really important thing that we have to address, and make sure that we keep addressing it, and we keep checking it out and trying to see what we can do to make things even better. All right. Now, the one of the issue we also have, and since we're talking about the U.S., there was one study I'm seeing about the South's stubborn approach to medical expansion. The
mm,
Medicaid program has been a lifeline for low-income Americans, pregnant people, elderly people, and people with disabilities. It is jointly funded by states and federal government, and has been operating for about 54 years. As of August 2019, the Medicaid program, covered about 68 million people, with African Americans making up about 20% of the Medicaid enrollees. Because African Americans tend to be poorer than other demographic groups on average, public health insurance programs such as Medicare are vital to ensure affordable health care and healthier outcomes. In states that have no expanded Medicare under the Affordable Care Act, we find that African Americans and other people of color are most likely to fall within a coverage gap, meaning that they earn too much to qualify for the traditional Medicaid programs, yet
Yeah.
not enough to be eligible for premium tax credit under the marketplace plans. So you see, there's still some holes in the Affordable Care Act and what we have. So we have a group of people that find themselves then in a position where they have too much to get the Medicaid, but they're not making enough to be able to get the discount and get any help under the Affordable Care Act under the marketplace plan. So I think, for us to think that this is like overdone because we have the ACA, I think we need to, get back in the face of our legislators, in the face of all of our people involved. We got to go and remember, they say politics is local. All
Yes.
right. And I think being that we are the children of God, we can't just, hide ourselves in the church. We're back to that again, overseer. We can't
Yeah.
hide ourselves in the church and then expect we're going to see changes happen. So
Yes.
one of the things and one of the duty of Turning Point is to stir you up. So you realize that, there's work for all of us to do. And it starts with, listen, I'm not saying you have to run for office, though some of us should. But what you need to do, you need to be in the faces of these people who have these offices so they understand that, they didn't go in there just to sit back and to, cut their 10, as we say, but they went there to get something done. And I think we have to keep the fire burning and keep this honesty going. Go ahead, Overseer. Mm-hmm.
Absolutely. Absolutely. Uh,
Mm-hmm.
as we look at healthcare, the other thing that comes to mind is also how it's structured, right? And as you declared, Medicaid is definitely a big part of access to healthcare, and not many of our African Americans make enough, and those who make a little above still have the gap, and as a result, they tend to fall through the cracks. So
Mm-hmm.
we have to be more vocal, as you said, as pastors, as leaders of the community, bring this to the forefront because it's impacting our own membership. It's impacting our senior groups. Many now are no longer are working and have no access, very little, and find themselves in nursing home and pretty much just counting the numbers
Mm-hmm.
to die. So yes, I believe we have to become more vocal as leaders.
Yeah, and I think it's gonna help, And I said, no, there's definitely separation of church and state. We're not telling you to ball it over, but you're a citizen. You're still a citizen, and being a citizen, I think we all have the responsibility to just make our presence known and let
Yes,
people know what it is that is affecting us, what it is that is making us not expand as everybody else. And of course, we'll talk over the weeks about a little bit more about the income disparity and all of that stuff. But as I said today, we're focusing on healthcare. And one other thing is, and then I know our program goes beyond just the Northeast. So I wanted to spend a little time that we see the southern states under the ACA, Medicaid eligibility was expanded for adults with incomes up to 138% of the federal poverty level. This expansion was originally written into the ACA as a requirement for all states, but due to the 2012 Supreme Court ruling in National Federation of Independent Business versus Sibelius, it is now just an option for states. So to date, 37 states, including the District of Columbia, have expanded Medicaid, either through their traditional means or through the Section 1115 waiver. But the states that have not expanded Medicaid are largely concentrated in the southern region of the United States. So as much as we're going through up here, we see the southern states, is really, going. So in the South, African Americans are disproportionately represented, right? So according to the U.S. Department of Health and Human Service, the Office of Minority Health, 58% of African American population lived in the South as of 2017. And they are
Mm.
also more likely to be uninsured, with Texas, Florida, and Georgia being home to the largest shares of uninsured African Americans. Now, some states have also proposed draconian work requirements as a condition for participation in the Medicaid program. So these requirements actually, also make it then harder. Right. So some of the states that have done that is like some of the states that have done this is those like Arkansas and some of those. So what they do is they only serve to stigmatize enrollees, deny coverage, and then discourage low-income people. So there's a lot more yet for us to do, and we need to realize that we have to still be in that fight. In Arkansas, for example, one of the 9 states to date with the waivers approved by the Trump administration allowing fully implementation of work requirements. 18,000 low-income people lost health care coverage as a result of that because of all of these rules that they have. And there's also, many other rules that are in the courts and things that are going on. And so we see, I want to tell people that, we have to be prayerful for our Southern brothers and sisters, because as much as we have it hard in the North, they have it even harder because of all of these rules and laws that are there that really makes this disparity even greater. hmm Yep.
And
So
then also,
we can work. Mhm.
another area is immigration, immigrants coming in, right? There's
Definitely.
immigrants coming in, and not many are documented, and as
hmm
such, uh, not many states allow undocumented access to health care. So we also need
Yes.
to look at how we're treating the immigrants who are undocumented.
Yeah, that's a very important point because and also even some of them that are documented because they don't understand the ropes and how to maneuver the whole thing. We find that some of them also don't get what they actually even entitled to. And
True.
so as the ministers and the pastors, I think we should all have probably an office of not even so immigration but integration, where we help those to integrate into the system, because over the years being a physician I've had a little bit more access to people of all kind, and it's amazing the amount of people that I've been able to give the right direction
Wow.
that didn't even know that they could have the access. And thank God, New York and even somewhat New Jersey,
Yes.
the clinic systems really do not discriminate against whether you're an immigrant, whether you're documented or not documented. They actually, do a good job.
Yes.
I know New York even probably does better than New Jersey, but they do a good
Yes.
job of, getting you incorporated, and it's more they're looking out for your health. So I think a lot of people sometimes are afraid, though, as you said, of going to even the clinics and going to the places that are there. But I think we want to, let people to realize that you can reach out. You should not, need health care and not get it, especially in the Northeast. I cannot speak for the South because I don't live
Yes.
there, but but we can speak for the Northeast at least, that there's access, and I think they're trying to do that on a wider range. So some of it, you're right, is just fear
Yes.
of the system and fear of what they're up against. Now, a little bit more talk, some of the disparities in health outcomes. And we kind of started to talk a little bit about that when we talked about, the COVID-19 and some of the different things. So increases in health insurance coverage under the ACA have improved access to Medicare and have often been linked to better outcomes for some of African Americans, such as earlier diagnosis and treatment of certain cancers. However, I want you to understand that disparities still exist across health conditions when comparing African Americans to whites, including maternal mortality, infant mortality, heart disease, diabetes, cancer, and other health issues. Social factors, including economic disadvantage, inequities in education, as we mentioned before, lack of access to health care, and the impact of a person's ability to lead a healthy and productive life. All of this is affected. For people in American society that experience racism and
Mm.
inequality in their daily lives, and throughout their lifespan, the impact of social factors on healthcare are the most grave. Even with improved access to medical care on ACA, this disparity in health content between African Americans and whites is still quite stark. It's a big difference. African American women are 3 times more likely to die of pregnancy induced related causes than white women. African American infant mortality rate is twice the rate of white infants. African Americans are more likely to die from cancer and heart disease than whites and are at a greater risk for the onset of diabetes. However, death rates of African Americans with cancer and heart disease did drop over the 50-year period. And across many chronic illnesses, however, African Americans are still more likely to die compared to the other racial and ethnic groups. Homicides are also a leading cause of death for African Americans, and in fact, African American children are 10 times more likely to die by gun violence than white. So there's still a lot of disparity. That's basically the point I'm making. Right? There's still a lot of it out there. And, we will try and dive into some of the reasons why this is. And we've talked about the socioeconomic reasons. That's one of the big things that we see. One of the big areas is that, the lack of health coverage and such alike. Now, in any other thoughts, Overseer, as to some of the reasons why we have the various disparities?
Yes, quite a little bit that I'm reading here talks to, besides education, it has to do with our lifestyle and our culture, and which speaks to our way we eat, lack of exercise, uh, food portions, uh, not having access to even a car, being able
Yep,
to get to the different locations, right?
especially if you
So,
live in New Jersey.
yeah, you know,
Yes,
the habits, the lifestyle, smoking, drinking, lack of physical activity, life stress. These are some of the barriers to healthcare, and education, not so much academic, but making folks aware of the importance of smoking, what does the harm it does to the body, the diet, a good diet, the lack of physical exercise, having a life that is, know how to deal with stress. Uh, During this COVID, there's been a spike in divorce, spike in suicide, spike in domestic violence. So there, here is where the church, and we are a spiritual, we are all pastors, where the church has a critical role to play. Gotta remind folks that Jesus is still the answer. He's still in everything. He talks about moderation in our eating. Talks about, I wish above all things that you prosper and that you be in what? Good
good
health.
health.
And without good health, everything else crumbles. Everything else falls. Your dreams, your aspirations, your goals will never be materialized if you don't have good health. So
You're right about that.
we have a part to play as human beings, whether we're African Americans, whether we are brown, Latino, Caucasian. We have the responsibility to take care of this temple that God has
Amen.
given us.
I think that's a very, very great point. I mean, and as we look a little bit more at the various things, we know all of the external forces that are there and all of the external things that are there that is going to affect, your overall well-being. But the internal things, the things that we can control, and we'll probably spend one this session talking about it. What is it that we can control from that
Yes.
standpoint? And you're right, health is one of those big things is in our control. And making sure we're eating right, exercising, and such as you're pointing out. So we'll definitely spend a little bit of time on that, to kind of bring it together. Now, there's also what we find is a healthcare provider shortage. So due to uh, 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 the residential segregation, majority African Americans and Hispanic areas are more likely to lack hospitals and other healthcare providers. Therefore, place matters. So when healthcare providers are located within majority African and Hispanic neighborhoods, they tend to offer lower quality care. And they're not sure why, but often people of color find themselves relying heavily on community health centers, emergency rooms, or outpatient care, and community-based providers due to the lack of availability of primary care and mental health providers in a given geographic area. So traveling outside of the immediate area to access healthcare may be an option for some people, yet this can be a challenge, as you mentioned, transportation to lack of access to transportation for those with limited income or for those living in rural areas. So it is not difficult to locate where and from whom provider shortages are a serious concern. The Health Resources and Services Administration defines health professional shortage areas as geographic, population, or facility based designations that are indicative of healthcare provider shortages. And we see designations are made by the following, all these kind of agencies that do that. So we see in 2018, there were 17,657 geographic areas, population, and facilities identified as health shortage areas, and not having enough healthcare providers, mental health and primary care, where the disciplines were in the most shortage. So we do realize that's another issue that there's
Yes.
medically underserved areas and populations are under designation. So what we find is that from their identifying specific populations that are likely to experience barriers to health are those including the homeless, low-income people, people eligible for Medicaid, Native Americans, and migrant farm workers. So we see a lot of populations are running into this problem. So this designations are made by calculating the population to provider ratio and all of that stuff that they look into. So that's something else we know that caused some of the disparities is really depending on our union healthcare shortage area, and
Yeah.
then you may run into that kind of problem. So you see, this is really a very very wide ranging topic because there's so much that is involved in this.
And
Now there, go ahead.
healthcare is also a profit making business. So
Hmm. Hmm.
when you're in the urban neighborhood, the lower the income, the lower the tax, the lower the revenue. So therefore, it's not
Hmm.
profitable, right?
Yeah.
So as you said, the clinics, the healthcare centers, and of course the emergency rooms and hospitals are not within; they're without. So you got to transport a patient. By the time they get there, thank
Hmm.
hope to they don't die. So it's a profit making business, and we have to see how the government can really step in and equalize that, provide some subsidies to these hospitals to ensure that the access is within the neighborhood and serving the residents of that neighborhood.
Yep. That's very very important. And like there again, goes to the local. We have to start hooking up with our local politician or local healthcare leaders or local movers and shakers,
Yeah.
to kind of ensure that we're gonna get access and that some of these things are being addressed. Because it's really become a major issue and a major thing. Now, when we think of some of the other important considerations for healthcare specific to African Americans, we see, as we mentioned, certain social factors, also referred to as social determinants of health, have important implications for health risks and the ability to attain health insurance coverage. The things that are really an issue is poverty, income
Mm.
inequality, wealth inequality, food insecurity, and the lack of safe, affordable housing are just a few. And I think I just wanted to re-highlight those. These are the things that cause this disparity, especially when we're talking about a healthcare. Another important social factor in leading to poor health outcomes and economic disadvantage among African Americans is racism. because not only, and you mentioned this earlier, not only is it a stressor, but it also impacts who gets what in America, particularly healthcare. So
Yep.
racism, wear and tear in African Americans is a real thing. African Americans have endured racism within American society for hundreds of years. And listen, I don't know, I'm not getting political, but over the last 4 years, we have seen a rising up of racism. And we have seen, maybe it was just under the quiet, but it's really expressed itself in a
Yes.
massive way. And studies conducted over time have been consistent in proving that racism not only impacts social stratification, but also the ability of African Americans to be healthy, both mentally and physically. And this burden, a burden that has indeed incapacitated for many blacks and brown people in this country, causing African Americans to die prematurely and experience chronic illness and mental health challenges at higher rates than white Americans. So a lot of this disparity is also caused by racism. And because of that, because it affects us in every way, and according to a study published in the Journal of Psychoneuroendocrinology, racist experiences brings on an increase in inflammation in African Americans. And remember now, just people out there, this increase in inflammation rises the risk of becoming chronically ill. The
Absolutely.
researchers of this study assert that because of the body's response to stressors, such as the diversity of racism, results in compromising systems that are critical in fending off disease. Exposure to racism over long periods of time cause the health of African Americans to suffer greatly within the chronic illnesses and probably due to inflammation. Now, inflammation, what you have to understand, it causes chronic illnesses associated with increasing heart attack,
Yep.
neurodegenerative disease, metastatic cancer. So the study participants had socioeconomic backgrounds which eliminated poverty as a stressor, and social factor was also, they ruled that out, and there was linking a lot of these just to the stressors that was because of racism. So I can't stress that enough. That's one of the other things, Pastor, that we have to address from our pulpits. We have to
Yes.
address it in our small groups. We have to address it everywhere, and we have to let people understand. And then we have to also give people a way out and how to
Yes.
deal with the stress
Yes.
that comes
Yes.
from the exposure to racism. Go ahead, pick that up.
Yeah. Yes. And I mentioned that. I mean,
Yes, yes.
racism, racism is a whole topic in of itself.
Mhm.
When you go back to the Jim Crow era and look at Brown versus Board of Ed, try to equalize access to education, and that still happens today. Uh,
Mhm.
the universal health care, that needs to really be something that is enacted and becomes a reality in America. Be surprised to know then how many the cost, the preventative costs would really go down. And when you look at other countries like Canada, you look at UK that does have universal health care. I still don't see why the richest country in America don't see that as something so important to make sure that everyone have access to equal health care.
Well, I have to say that, and in lieu of being people thinking we're a little political, is racism is a big part. Racism is a big part of the problem because um, we have a group of people who think they're better than others, number one, who think that they're superior to others, number two, who think that they can do what they want to do and not with any regards to anybody else. Number three, so there's a lot of that. That at first, be honest with you, I was a little bit naive because we grew up in the West Indies, at least part of my life. And trust me, you didn't see, I'm sure it was there. There was a little class system was there, but it wasn't really as rampant. And coming to the U.S., and I lived in Colorado, and believe it or not, I didn't see as much there, and that probably because the majority was white. However, was treated perfectly normal. However, as I started looking at the especially the African those born in America,
Yeah.
And I think I had to put myself in their shoe. And I think some of us that are West Indian born, miss this also, that these people have been oppressed and held under for so many years that they actually act in a certain way,
Mm.
until they get the light goes on and they get the knowledge that they're equal and they're should be as good as anybody else. So it's a whole, race thing that has, depressed and oppressed them over years. And I think one of the things we need to do to be sensitive to that and do
Yes.
everything that we can to lift up and to bring everybody up, and to let people realize that, they're God's creation, they're made in God's image, and that they're good as anybody else, no matter what the color of your skin or the color of your hair, or if your hair is straight or if it's kind of curly. All of that doesn't matter, but we are all been made in the image of God, and that we have a right to survive and to live and to excel. And I think that's the other thing that we are obligated to do. This generation that is coming up, we need to teach them,
Yeah.
and give them the instruction, let them know what they have to be aware of, let them know how to act, how to handle themselves, and just come out from under this, oppression that we're on. Racism is probably always going to be there. It will go back to the Bible, way
Yeah.
back. It
Yes.
was there.
Yes.
But it's how
Yeah.
we then act and how we react and how we take it on, and we need to let people know that we know what you're doing. We know what it is about. We're here to stay. We're here to
Yeah.
excel, because it's there. No matter how you look at it, it's always there. And there was one very interesting study, actually, that a group out of the University of Michigan did. He was a public health researcher. Her name is Arlene, and her last name is too long. But after looking at biological factors associated with exposure to stressors, she hypothesized that in what is also referred to as a weathering hypothesis, that African Americans experience health deterioration because of the stressors. And she
Yes. Yeah.
actually did a whole study that and it's like the cumulative wear and tear on the body system brought on by this repeated adaptation of stressors. So she found that for adults aged 18 to 64, this was definitely true. African Americans were found to have higher scores than white Americans on this test she did. Once again, parity was ruled out as a factor due to the fact that the higher, they kind of ruled that out. But when they look at everything else, they found that she concluded that racism and the burden of coping with it across the lifespan leads to differences in health among African Americans and white Americans, including the onset of the chronic illness and premature death. So it's really, really a real thing, and
Yes, it
we
is.
need to, be well educated about it. In addition to instigating poor health among outcomes among African Americans, racism also creates barriers to economic opportunity, and then uneven access to healthcare. So even the healthcare system itself perpetuates this racism and bias towards African American. And this has been well documented with examples including differences in pain management and treatment of African Americans who compared to whites experiencing the same health condition. So, use of African Americans' bodies in medical experimentation, we know about that, and racial bias in health algorithm for the purpose of guiding health decisions and assessing healthcare. All of this stuff, is out there. So, actions like these have led to general distrust of the healthcare system. We go back to talking about some people don't want to have the vaccine, the COVID immunization. There's been an element now of mistrust, and
So,
racism cannot be divorced from the other social factors that we see in this report that I was looking at. So
so
everybody needs to be aware of that. All right,
yeah,
and we need to go ahead.
yeah. Let me ask you this question: Are you
Mhm.
saying, based on what you just read, that because you being African American, if your symptoms is the same as a white person, the type of prescription would vary?
Yeah, I'm saying I'm saying the whole thing, the type of care. I mean, first of all, this from a couple of studies that they did. Take me going to the emergency room, a Caucasian going. I
Right.
am going to get a different treatment because of the color of my skin. And that's been documented. And that's when, remember last week I was saying you have to advocate for yourself. You
Right.
have
Right.
to you have to understand what you're entitled to. You're entitled to good care, and you have to kind of fight for it. It's the difference, even in the pain assessment. For the one study that they did, in just two people of different race. Even though one person may say they have a pain level of 5, the other person may say they have a pain level of 5, but they get different treatment based on the color. They have done these studies, and it's clear that the racism spans the whole medical system.
So
You know,
so
it, mhm.
so let's go deeper. So if you go to a doctor of the same race, African American going into an African American doctor, do we still see that problem?
It's bad. No, it's not as bad. Definitely not. It's actually a better thing because, of course, they will tend to understand you more from where come from. So that's why if you find, I find a lot of patients who are African Americans try to seek out an African American doctor, or somebody that they've had a relation. And this also is different when we're talking about your primary care doctor you have a relationship with. So this
Right.
is more like on the general front. Say, we both go to a clinic,
Yeah.
and we take two of our white buddies and we go to a clinic, we're going to get treated differently most of the time because of that's just the nature of still the amount of racism that is in the country. And they have done studies. They have done studies. We can look up specific detailed studies that have proven this. And so this is something that we are working against, though. And so the
Yeah.
other thing is, us, the African Americans, we have to be educated in this fact so that we know to look out for it. And
Right.
therefore, that's what I was talking about advocating. So you say you go and you have a complaint, and somebody just brush it off. No, no, you don't stand for that. Said, okay, I came here, I have this issue, and it needs to be taken care of. Let me speak to the person in charge.
Right.
You take it up. You have to not just sit and just roll over and let them just kick you out, but you
Right.
have to roll over and get up stronger on the other side and stand up for what you know is right. So, should we have to do this? No, but it's the nature of the environment, is the nature of the society. And actually, as I was saying, over the last 4 years, you have seen a lot more of it. It was,
It's hard,
some of this was dormant. Hmm.
it's hard to believe that
Hmm.
and I'm not trying to be naive, that
Yeah.
someone would go in the healthcare field and would actually look at your skin and determine the type of care as opposed to the illness. It
Well,
is very
some of it is, and we're getting a lot better because we're educating the people and teaching. Some of them is unconscious.
yeah, it's a bias.
It,
He's not
it's,
aware of this.
it's a bias that is ingrained, and they don't even know. You don't even listen. Those kind of bias, you don't even know the person doing it. Don't even know that they're doing it. I mean, there's some
Or,
people, of course, that
yeah, or you
purposely,
could see
do it.
instructions from your superior to say,
Yeah,
when the African
yeah,
Americans come in, here's the meds
yeah,
for the African
yeah,
Americans. When our
yeah.
Caucasians, you do this, and it may be a
It,
big
it's
assistance.
something. It's something up here. It's almost like, all right, I go in and I tell the person, "Man, I'm in pain." And for some reason, a white person will come in and say, "I'm in pain." It's just perceived differently.
Mm,
And of course, and I know the medical schools and stuff are doing a great job in trying to just change that because we do cultural competency courses,
right,
and on all of that, and all of that. So we're seeing a lot more of that being done, and I think over time. But I think to be naive and not be aware that it exists, is a thing. And I think we need to have us all working together. Because what I do when I see it is not like I don't really get angry at the person, but I actually
right,
kind of point it out to them, said, you didn't realize that you did this, but hey, you have to be, conscious. I said it's almost an unconscious action because it's so ingrained in the society.
right,
That it's almost like, I mean, come on, think about it. You a store owner, you know as a store says, especially if it's in one of these white neighborhoods, and a white person come in, they can almost take the whole store and leave. They won't say a word to them. A black person come in, they trail them around the store.
Yeah.
Does that happen?
Oh,
Does that happen?
I asked him if
It
that's my personal escort. Is this my
Yeah,
personal escort?
exactly. You
I
got
if
an
you could
escort. Yeah.
help.
So what you do now when you go to the store and you see that and you said, okay, good. You want to help me? Can you help me find this, and this? Here I have money. I'm going to pay for it. I'm not taking it. So
Come to work. Call it out
but
and say,
but
okay, you find this.
but I'm telling you. So that's the point I'm saying you. So and does that person who got up in the morning and said, okay, no, the first black person to come in, I'm going to do this? No, but automatically they do it because of what's been ingrained in society. There is a race disparity, racism that is deep there that we have to now educate because this racism is causing a lot of havoc in African Americans' lives and their health. Because believe it or not, just about most diseases, the inflammation is the bottom line cause of the problem.
Mhm.
Inflammation is what causes an inflammatory process in your system. What's called the arches to harden is what causes the cells not to function. So if we could, get rid of some of that stressor that's even coming just from that, can you
Yes.
imagine where we would be? So of course you got me excited talking about this. That I'm going off now,
This
but
topic
it's
is
important.
rich,
Yeah.
and there's so many
Yes.
ways we can take this. And
Yeah.
uh, when we came up on the topic, I said
Yeah.
if we go down this route, we will never
Yeah.
get done. Glad we
Yeah.
kind of it to
Yeah.
healthcare, so we can
Yeah.
really.
So we'll do healthcare, and I think we can do some. We'll probably decide which ones we'll do next week, but we'll probably stay on the topic. I
Yes.
mean, and wherever necessary, we'll intertwine COVID because it's still active. But we can intertwine that a little bit because even right now, we're seeing that the amount of people getting vaccinated is very low in the African American group, and we know a lot of that is because of the fear and all of that. But we will talk more about that. But of course,
Yes.
we have enjoyed talking. Overseer, last words for you for today?
Yes, well, just want to encourage everyone. As we see, there's definitely disparity, there's definite racism. Take care of your health. You are the best advocate for yourself, and as you go about to seek proper health care, make sure you tell your healthcare provider, here is what I'm feeling. Right? You know your body, and you may not be able to articulate it in medical terms, but that should not be a problem. You can really demonstrate or explain to the provider, as of yesterday, as of 2 weeks ago, there's a certain pain, I'm feeling dizzy. And don't stop until that provider gives you the care that you need. So I want to encourage you, take active participation in your health. God bless
Yeah,
you. God bless
blessing. And I'm telling you the quick story. I won't say names, but one of our parishioners, remember I told you, I think I mentioned it last week. She went to one of the big hospitals and they said, oh, yeah, you probably have a little pneumonia. And she was positive for COVID. Hoo
you.
poo,
Yes.
go. She ended up going to an urgent center, got a little bit better treatment, a little treatment for me. 5 days later, she was in the hospital for 7 days.
Mm,
Thank God she's home. And of
wonderful.
course, go back now. If that first place did not
Yeah.
poo-poo her and treated her right, I don't think she would have I would have been then spent a week in the hospital. So here's the moral of the story. If you're not feeling well, listen, go ahead, advocate for yourself. I can tell you, if you can reach me, call me. I will advocate for you because,
Yes.
because I would say it'd be too bad. See, one of the things with the whole system that we have now, even if you have a primary doctor, you go to the hospital, they don't necessarily call the primary doctor anymore because of now all of this hospitals and you don't. So it's a whole thing, but you call. So what I'm telling patients to do, you call. If you have any questions before you leave, you call me. Okay, because we can sometimes just call in and push some things and hey, you didn't do this and do that. This patient does not feel good. If she goes home and something happened, I mean, I'm always use that term. Trust me, and don't feel free to use it. If I go home and something happened, then I'm gonna have to say I was here and I didn't get care.
Right.
Trust me, they're all still looking for that customer service survey. They want a survey. So to let them know that if you, hey, this survey is not going to be so good because
Right.
I don't feel like you took care of me. So stand up for yourself, be counted, and we want to say have a nice week. God bless
Yeah.
you, and we will
Yes.
be back with you next week. Blessings, overseer, and stay healthy.
Yeah.
And stay out of the high storm that we're supposed to get tonight into tomorrow. We're gonna stay virtual again tomorrow completely.
Yes.
So do what you have to do. Stay safe. Get your COVID immunization as soon as it's available in your area. That's my recommendation. Remember, you have to make the choice, but that's my recommendation. And God bless you. God bless you. God bless you. Have a nice day.
Turning Point family, what an awesome time we just had. To all our first-time guests, we truly appreciate you for joining our live broadcast. We would like to hear from you, so please send us your comments, questions, or testimonies of how this program has impacted your life. Our email address is info@pflmi.org. Finally, if you feel led at any time to give to this ministry, please visit us at pflmi.org and click on the tab for donations. You can also give via Cash App at $PFLMIORG. We're looking forward to meeting with you live on next week's program. Have a blessed and prosperous weekend.